Hello, this is Dr. Apoorva Mangalgiri. I'm MD in internal medicine. The topic we are discussing today is common cold and flu. The main difference is the origin of both the diseases. A common cold is also by virus, and flu is also by virus, but flu is primarily only by influenza virus. And common cold can be caused by multiple viruses, which will include rhinoviruses, parainfluenza viruses, and some common coronaviruses, not to confuse with the SARS CoV 19. There are many viruses which can cause a mild common cold, or what is a normal cold which we see these days is the common cold. Common cold and flu can be acquired by any person if he's in close contact with a person with common cold. And if your hands are not very clean, you're not in a good health, your immunity is less. That is the ways we can get these two conditions. Both of them are communicable diseases. Like I said, they transfer from one person to another from air droplets. And when one person sneezes, the person who's infected, they can easily transfer that disease to the other person. So that's how we get it. In both the common cold and flu, we can get a runny nose, a blocked nose, throat pain, body aches, fatigue, that is not being able to get up to do your normal work. Eyes are watering sometimes, and fever is fairly common with flu rather than in common cold. But the symptoms of flu are much more severe than common cold. For a complete recovery, it usually takes around 7 days or to 14 days, but sometimes it also depends on your immunity and the environment you are in. So there is no set days for this, but generally 7 to 14 days, if I can say. The treatment, there is no set treatment for both. It's just your steam inhalation, symptomatic treatment, that is, whatever the conditions you have, like cough or throat pain or running or blocked nose, you can just take the treatment for that. That is, whichever is available over the counter. That means you do not need a prescription for that. And if your symptoms are a little on a flared up level, then you should always visit your doctor. And there is no role of antibiotic in common cold and flu because this is a viral infection, and antibiotics are given for bacterial infection. But also, if there is a severe infection, when your immunity is very low, you're also at a chance of acquiring other infections. And that is the time the doctor may start you on some antibiotics, but that is not to be given in self-treatment. Definitely, steam inhalation works because it helps to thin down the mucus when you take it, and it's a very good natural home remedy which you can take for common cold and flu. The other home remedies is taking a lot of water. Some patients prefer taking hot water. You can definitely do that, and continuously taking a lot of fluids, basically around 3 to 3.5 liters per day. That will help with fatigue, and that will also help with the general wellness during this time. And taking a lot of rest, taking these steam inhalations, gargles, salt water gargles works well. We can consult a doctor once the fever is very high. It's almost more than 2 to 3 days. The fever has not come down. The fever temperature is always 100 or 100 above, and the symptoms don't come down even after 5 days. Then it's better you see a doctor. The general health should be good. The immunity should be good. Your diet, it should contain all fresh fruits, vegetables, whole foods, and all nutrition rich. And your hands should be clean. You have to stay away from people who have common cold and flu, because then you can get the infection. And drinking a lot of water.